So you guys can push your got it's if you need to. I'm going to spotlight Dan. This is Dan Calow. Dan Calow is he's a chiropractor from Hybrid Health Rehab. Is that right, Dan?
Yeah, hybrid health and rehab.
Awesome. And so I thought that Dan would have more ideas on spine health than I could ever look up on the internet. And so I will put the class over to Dan, and as always, I'll stop the recording in time for questions at the end.
And that'd be roughly like 20 minutes and then questions. Is it like
Yeah,
you
20
feel
minutes.
free to cut me off if you need to.
Yeah, absolutely. Perfect.
Okay.
Perfect.
Okay. Well, guys, it's nice to see everybody. Nice to meet you. Thank you for tuning in, I guess, and thank you for having me. As Jody said, I'm a chiropractor and clinic owner of Hybrid Health and Rehab in the west end of Peterborough, just off Lansdowne. To kind of start the topic of spine health, I figure we kind of go over, just to start, the regions of the spine a little bit. There are different regions, and we'll kind of talk a little bit about just overall joint health and muscle health, because the two are very much going to be interrelated. And then we can talk about some general ideas to go about doing so. For the most part, these things are going to be geared at an individual without specific conditions. Okay, so aches and pains or back pain, that's not necessarily included as specific conditions, but say there is a specific previous injury or diagnosis that we might have, that might change the recommendations per person. So in general, these will be the kind of things to keep in mind, as opposed to specific things based on a person to person basis. So we do have a few different regions of the spine, as I mentioned. Four particular. One is going to be the neck or the cervical spine, which is 7 vertebrae. 2 is the thoracic spine or the mid back, which is going to be the largest part of the spine. And there's 12 vertebrae there, with a rib from either side, so compiling the rib cage. And then the low back or the lumbar spine, which is 5 vertebrae, and they're the largest vertebrae. And their job is generally more sustaining compressive force and weight bearing. And then the last one would be the pelvis or the sacrum, which when you're first born is 4 different vertebrae, but they actually fuse together to make a triangular bone called your sacrum, which creates 2 joints with the big pelvic bones. So the cervical spine or the neck is definitely the most mobile region of the spine, of course, as we can move our head in all kinds of different directions. And different parts of the neck or different vertebrae are going to be responsible for different movements. In general, the higher you go, the more mobile. So the majority of movement of your neck and head is between your top 2 vertebrae. It's about 50% of the movement of your head, which is quite a lot, given that there's 7 vertebrae and joints between each of those 7. 50% of the movement comes between just 2 of those. And as you go down the neck, the vertebrae are going to get a little bit larger, which generally means their job is to sustain more gravity loading or more force. The rib cage or the thoracic spine would be probably our least mobile region of the spine, because it has the actual cage around it, which of course limits a little bit of how we move. And oftentimes mid-back pain isn't that common, or the sensation of mid-back stiffness isn't that common, but a lack of movement in that area can play a huge role in either injuries or pain in some of its neighboring areas, like the neck or the low back. And the lumbar spine or the low back, the biggest vertebrae, like I said, and its job generally is to move us forward and back, a little side to side, and to sustain gravity-based loading. And the reason we know that is the actual curvature direction that we have in the low back, which is kind of a of a backwards arching curve, and that develops as you learn to walk as a baby. So once you start to walk, gravity's pushing down on you, your spine starts to develop a curve in that direction. And then where the sacrum articulates or has joints with the pelvis, these are called your SI joints. If you've seen a chiropractor or a physio or a massage therapist, they may have mentioned those things before. Those are where the little dimples are at the low back, kind of right around your belt. Those are our SI joints, where our pelvis has joints with the spine itself. And those are actually a lot less mobile than we might think. In a 10-year-old, extremely mobile gymnastic type body, there may be like 15 to 16 degrees of actual movement in those pelvic joints. And as we age, they actually tend to fuse. So not a mobile area to begin with, and that's not a huge problem because the neighbor of that area, the lumbar spine of the low back, does have quite a bit of movement, and the hips, or the ball and socket joints, that is the hips, have a lot of movement as well. And we can get into how that plays a big role in spine health closer to the end. So those are the regions of the spine. To talk about spine health, I kind of need to go through a little bit of overall joint health or muscle health. And it's going to be the same for any joint of your body to some degree. The spine isn't going to be as separate or special in these areas. Our joints and our muscles get nourishment, so to speak, or nutrients and oxygen from different sources. So your muscles, which you may have seen on diagrams, or if you're a meat eater, meat or muscle is generally red in color, and that's because it has a really rich blood supply. So all kinds of blood moving through your muscle tissues, and what that allows is bringing oxygen and nutrients into the muscle and removing waste products. So that's how your muscles get nourished or get nutrients and get oxygen. And that's important when we talk about the muscles of the spine or the muscles of anywhere in your body, because if you've exercised before and seen your face or your back muscles or something after your legs after doing a specific amount of exercise, you might notice that the skin starts to turn pink in the area. And that's because you're increasing blood flow into those tissues. So the first and easiest way to consider improving muscle health is to use the muscle. The more you pump or squeeze, contract, and relax a specific muscle group in any one area, the more your body is going to send more blood flow to that area, which means it's going to bring more oxygen to the area. It's going to bring more nutrients to the area. So carbohydrates or fat are basically the fuel you get from eating and digesting things. And it's going to remove waste products out of that tissue. And that plays a really big role when we talk about our static or sedentary behavior. If my back is hurting me because I've been sitting at my computer desk all day, or I've been traveling on a plane or a bus all day, I'm not injured from sitting there, but I haven't moved or changed the position of my muscle tissues in possibly a few hours. So by simply contracting and relaxing those muscles on repeat, I can actually pump more blood flow, more oxygen, more nutrients into those tissues. And that's a really, really important thing, especially when it comes to, let's say, the general aches and pains of not moving enough in the day, or from sitting too much or spending too much time in one position. So that's a really big thing when it comes to muscle health. I need to move those muscles every day, and ideally, especially in the spine, every hour. Like to some extent, I need to move them in an hourly basis. And it can be just that, like, and you may see Jody wiggling around there right now. Like, we truly need to move those areas as often as we can to promote better health of the muscle tissues, to prevent things like atrophy or shrinking of the muscle, or inflammation in the muscle, or aching or soreness. And so, as I mentioned, your joints get nourishment from a different aspect. So inside your joint is made of a couple of different things to kind of break it down in a digestible way. You've got two bones and a capsule around those bones made of thick ligamentous tissue, which just is thick, not so stretchy white tissue. And inside the joint on both ends of the bones is going to be cartilage, which kind of helps as a shock absorber and a gliding system, and some fluid inside that joint. Now, inside that little kind of capsule is a skinny little piece of material that helps produce a lubricant for the joint. So very similar to the oil in the pistons of your engine of your car, you have to move this joint to stimulate and actually create more of this fluid. It's called synovial fluid. You don't need to think too much about what it's called, but if you have a joint that moves, it's called a synovial joint. And that synovial fluid is produced by the inside of the joint by stimulating and physically pumping or moving the joint. So the more you move it, the more it produces and recycles this fluid. And the more you move that fluid through the joint surfaces. So around the cartilage or throughout the joint region to help nourish those joint surfaces or the cartilage. Okay, so my muscles have blood flow to pump and move some of that nutrition or oxygen or things like that around. My joint does not have that. And if you've ever had an injury where you've injured the cartilage in one of your joints, maybe your knee, you've hurt your meniscus or something like that, they take a lot longer to heal because there is no blood flow to the tissue. Okay, so joint health truly is going to come from moving the joint. And not just kind of moving it, I need to move it and explore as much of the range of motion that that joint has as I can possibly do safely and comfortably. And that would also be on, at the very least, a daily basis. But again, hourly would be better. Okay, so those are kind of the biggest things of joint health and muscle health, whether it's spine or shoulder or hip or ankle or knee. Kind of put short, motion is actually lotion for your body. And it's not all going to be the same. Like I know, you may have a joint in your back or maybe your neck or your knee that doesn't like certain movements and it gets pretty sore or it feels a little bit of pain. The big things to consider is that the discomfort we feel at times when we move those joints, especially if you're gently moving them, like me moving my neck like this right now, feel a little bit of a pinch when I do it over here. And I wouldn't call it pain, but it doesn't feel good. But that sensation is a reminder, okay, something over there, not too happy with that movement. But what I can tell you is I know that me moving my head like this isn't enough force or enough thrust or speed or strength to damage any of my tissues. I know that my bones and my joints and my ligaments and my tendons and my muscles are strong enough that they're not going to break or snap or do anything. So even though this hurts a little bit, I know I'm not causing it damage. And lo and behold, now that I've done it about 5 or 6 times, that little pinch is actually gone. Okay, so a couple of things to keep in mind if you have a specific joint or area that doesn't like a certain movement, that doesn't necessarily mean feeling that discomfort is causing it an injury. Okay, so that can be a tough one. And again, I mentioned this is kind of for the average or relatively healthy spine or joint. So if there are specific conditions, there may be things we want to take into account or adjust for. But overall, I want to find safe ways that I can comfortably, without too much discomfort, move the regions of my spine. So my neck, my thoracic spine or upper back and rib cage, and my lumbar spine through as much of their full range of motion as I can on a certainly daily, but hopefully hourly basis. And that would be best done from the age of 2 and maintained to the age of 100. But of course, that's not necessarily the life we live. And a few things that I see a lot of are younger and younger and younger people with aching, stiff backs and necks, like 10-year-olds and things. That's kind of shocking because of the amount of time they spend in any one given position, which usually is sitting, but it doesn't have to be that kind of thing. So spine health and joint health and muscle health need movement. And if there's a specific movement you're not sure of or you're tentative of because it's a little bit painful, we want to make sure we can find a way to gently move through that range on our threshold of discomfort. So as I mentioned, that little pinch, I feel a pinch there, but I can go further. Well, maybe I just kind of work back and forth within the range of the pinch. And after a few reps, all of a sudden I can move further without that pinch. So that's something that we want to keep in mind. So moving my spine on an hourly basis and putting focus into those areas, the neck, the upper back and rib cage, and the lower back. And so we would call that kind of exploring your range of motion. Yoga may be a good one, or Pilates or Tai Chi is a really, really good kind of exercise to do. So I like yoga. One thing where it can be a little bit of an issue for some people is the sustained stretching. So if I have a range of motion that I haven't done much of, I know it's a range that I should have, but I haven't done that at all in a few years. And I go and I put my body there and I hold it for a minute, there's a pretty good chance that I can make it sensitive or painful in doing so. I haven't blown anything up or broken a bone or anything like this, but I certainly might feel that at the time or the next day. So yoga is a great thing because it's going to get us to explore some new positions and new ranges of motion. But we want to make sure if it's new to us, we're not pulling too hard or too far, and we're maybe not spending too much time there. Maybe we go to the position, feel it, breathe, and then remove ourselves and repeat it, as opposed to go there and hold. But as we do it more and more, maybe you're 2-3 months into yoga, now you can handle 30 seconds, 60 seconds, that kind of thing in the position without that discomfort. So it's basically exploring your range of motion a little bit at a time and building on it on a daily or weekly or monthly basis. Okay. So if it's a new movement or a new activity or a new region or range of motion, I want to explore it within my tolerance and keep a threshold in mind of what I feel. And then I want to do it more and more and more often, and it'll get easier and cleaner and more fluid and more fluid. Okay, so those are important things to keep in mind as well. Now, with that in mind, I want to talk about exercise, because exercise is good for spine health, and that's a pretty blatant statement. And everybody probably would say that. It doesn't seem to be crazy science to say exercise is good for spine health, but what does exercise mean? We're going to talk about kind of general exercise and then focal exercise. So I already sort of touched on focal, meaning my neck moving. This would be focal exercise for my neck, but this isn't general exercise. I'm not going to, burn a ton of calories or lose weight or that kind of thing or get super strong by doing that. So general exercise is going to be something like walking, jogging, biking, whatever, something that gets our heart rate up, our body temperature up. It's going to loosen up our tissues, our muscles, our joints. It's going to get blood flowing. It's going to get some of that synovial fluid in the joints moving. General exercise is going to promote overall body health. It's going to decrease stiffness because of those things. We're warming up our muscles and joints. And when I say warming up, truly we're warming them up. When you pump blood into your muscle tissue, it's actually hotter. That's why your skin starts to turn pink. Okay, and same thing in the joint. When you move the joint, you move that fluid around, you're actually warming it up. Just like I mentioned, the pistons in your engine of your car. So the general exercise is a good thing, and we need a lot of that in our life on a daily basis. One, for the health of our body and overall. Two, for maintenance of body weight. And certainly, people would agree, higher body weight is bad for your spine. And that's not totally true. That's not really the best way to put it, because you could be 300 pounds of solid muscle. That is not necessarily harder on your spine. We also don't put weight on really, really, really fast. And by really fast, I mean overnight. which means that as we're gaining weight, if I'm gaining weight, I'm also, my body and my muscles and my joints are getting used to that because it's a slow increase. Okay. So the one thing where general exercise is going to be helpful is it's going to help me move more and manage any weight gain that may come. And that's meaning I'm burning more calories, I'm moving my muscles more, I'm using my heart and lungs more, and that's going to be better for my body overall. Okay, so it's going to increase my muscle mass or maintain muscle mass and increase my mobility in certain regions. But general exercise like walking isn't necessarily going to put a ton of focal movement through different areas. When you walk, you're not looking all the way up to the sky and all the way down to the ground and turning all the way and turning all the way. You're not bending to touch your toes. You're not turning your rib cage as far as you can. So general exercise is great for overall health and certainly for some parts of spine health, but we may need that focal exercise or focal movement to make sure that we're having healthy movement in those regions of the spine that we talked about. And I can't quote the person directly at the time, but there are some professionals who've kind of referred to it as a movement diet. Similar to your eating diet, you have micronutrients like vitamins and minerals and macronutrients like fat and carbohydrates and protein. Well, with movement, you're going to have macro exercise, which would be your general walking, biking, running, and micro exercise, which is going to be specific movement of one region: neck, upper back, lower back, hips, that kind of thing. And again, that may be where something like Tai Chi or yoga, or even if you have a specific region or if you see a professional, they may help build a little bit of a routine for that area for you. So if it's your neck, you do every hour these forward movements within your tolerance of discomfort as many times as you can, as far as you can. And what you're simply doing is just moving those joints often. Keep them healthy, keep them limber, keep them mobile. Excuse me. And keep the muscles moving as well. Now, there also is some contribution of strength in spinal health. And with aging, everybody has a progressive decline in their amount of lean body tissue, which would mean muscle. So as we age, we lose muscle, and that is just the truth. So we want to do things to try and maintain our muscle mass. And again, that may be general exercise or our macro exercise, as well as our micro. It could be strength training with weights, which is a really good thing. Men and women of all ages is very, very, very much a good thing. If you have a professional like Jody or someone you trust who can help you through those, you feel comfortable with it, anything is good. You don't have to start with big barbells and go to the gym and wear cutoff t-shirts and grunt and make all kinds of noises. All of it is good, but resistance training for people of all ages, including seniors and pre-seniors, 30 and over, is absolutely necessary, because that decrease in muscle mass as we age is related to all-cause mortality. So anything that can shorten our life or make our life worse in some way has a statistical relation to a decreasing muscle mass as we age. So everything we can do to reverse or decrease or slow the decline of muscle mass is good for our overall health, especially our spine health. And that would be the general aspect of strength for spine health. Locally or focally, I would want to make sure that I maintain strength in things like my core, so my abdomen and my lower back and the muscles on my sides, because they help me pass force across my spine. My spine is tons and tons of little joints between all those vertebrae. And I need to, if I want to pick something up, I need to lock them in place. I need to squeeze with my muscles so that I can produce force and move it across my spine. My best way of putting that would be your hand and your knuckles. If you're going to punch something, hopefully you don't have to punch anything, but if you're going to punch something, would you do it like this with a fully open hand? you're probably going to break your fingers. You want to squeeze, right? You squeeze those muscles and you lock those joints. And that would be kind of what your core muscles are going to do if you go to pick up something. They're going to squeeze everything, lock those joints in place to allow you to produce some force. The next big region we want to maintain some strength for spine health is going to be through the hips. That will be the front of the hips, the hip flexors, the side of the hips, part of our glutes, and the back of the hips. The glutes are our butt. And what these are going to allow us to do is spare our spine with different movements. So I'll try and show you here if I can, but I'm sure a movement that Jody's maybe shown you guys is something we call a hip hinge, which is what allows me to load my hips and legs while sparing my spine if I'm going to pick something up or produce a load. So if I wanted to pick something heavy up, remember my spine has all kinds of little joints and muscles. If I were to move like this to do so, I am putting that force through many of those smaller joints and muscles. If I was going to pick something heavy up, I may use my core to lock myself and hinge at my hips in order to use my larger muscles to produce force to pick that object up. Okay, and it's pretty common that we have to pick things up from the floor. I'm sure you've all probably done it within the last hour. So another area we would want to maintain some degree of strength is going to be in the hips and legs. These are going to be really helpful for health of the spine, particularly the low back in that case. And for the neck or health of the neck, we want to maintain some strength in the shoulders and shoulder blades. These are attached to my neck and my upper back. So in order for me to lift or move or pick things up, I need to have some ability to produce force in those regions so that I'm not transferring all that tension into my neck. Okay, so those are some things we want to keep in mind. I know that's pretty general, but again, global exercise, walking, bike riding, running, skiing, swimming, these are going to help me maintain the movement and the fitness and the mobility and the strength that I have in those regions. It's also going to help me burn calories and maintain a lower body weight and have a healthier brain and a healthier heart and lungs. And focal exercise, say squats or deadlifts, which are a stupid name, but picking something up from the floor, or lunges or specific core exercises. Those are things that are going to focus on the focal health or focal strength of different regions. And that can come with, again, seeing a professional like Jody or someone you already have as a trainer or a therapist who you trust, who can build a program that's right for you where you're at right now and get you started moving forward. So all exercise is good. Everybody needs to do some degree of it, strength training in some aspect. But everybody's going to have a different starting point based on what their joints can do now and what their goals are. So that is kind of the biggest thing when it comes to spine health. We want to move our joints as often as we can within our limits and ranges of discomfort, because our range of discomfort will increase the more we do that. And we want to use and load and strengthen our muscles throughout those ranges to maintain healthy joints as we move through our daily life. I hope that's not too broad. I also hope it's not too specific. Do you guys have any kind of specific questions about any of that, or about anything you'd like to ask?